Hi, I'm Dr. Sorkin from Dr. Sorkin Center for Women's Health, and today I'm going to be talking to you about osteoporosis. Osteoporosis is very important because it means bone weakness, and over 200 million of the world's population suffer from it. Now, why is it important? Because weak bones lead to fractures, and fractures can lead to nerve pain, back pain, immobility, stuff like that, restriction on activity. So we want to avoid that. How do we diagnose it? Well, first it's important to understand how a bone works. So a bone is a combination of bone tissue and pores. And what happens as a woman or a man ages is the pores get bigger and the actual bone matrix gets smaller. And that happens in women faster than in men, and it tends to accelerate after the age of 50 when menopause kicks in. Well, how do we diagnose it? The way I diagnose it in my patients is I do a DEXA scan, which is basically a machine that scans the bones in my patients, and then it generates a report which looks something like this with numbers. Now, if you have a T-score of -1 or better, which is in the green zone, that's normal bone. Anything between -1 and -2.5 is called osteopenia, which is weak bone. And then anything -2 or lower in the orange and red zone, that is osteoporosis, and that's a high risk for fracture. Well, how do we fix it? The key thing here is start early, because once the bones get weak, it's very hard to bring them back, and it takes a long time. So by being proactive and taking supplements, you're going to slow down the process and keep your bones as strong as possible. So number one is calcium. Calcium is the brick that is basically what builds bone. So the recommended daily dose is 1,200 milligrams a day. In addition to calcium, it's important to also add vitamin D, because vitamin D basically helps your bones absorb the calcium. Finally, if someone has severe osteoporosis, we need to add medications. So the types of medications vary depending on the age of the patient, the medical problems the patient has, and such. So that's all for now. Be aware and take care.